Alcohol breath testing. Testing for alcohol in breath is now universally accepted as the most practical way of establishing what the individual's blood alcohol level is. Alcohol in the bloodstream has direct correlation with impairment. There is a close relationship between the level of alcohol in the blood and the level in breath at the time when, deep in your lungs, your body is getting oxygen into the bloodstream. As the oxygen is exchanged with carbon dioxide, a proportion of the alcohol present in the blood evaporates into the breath. This relationship is the basis of breath testing enforcement of drink driving legislation throughout the world. Most breath test machines are designed to do the analysis on the last little bit of air coming out of the lungs, at the point where the individual cannot blow anymore. They have a flow rate sensor to detect when people are blowing too lightly to give an accurate result. We describe these machines as evidential. In other words, you have a result on which action can be taken. Some machines can only be used as screening devices, as they measure the alcohol during normal respiration rather than deep lung air. Any positive result would have to be confirmed on an evidential machine. Because the machines measure breath coming through the mouth, it is important to make sure that there is no alcohol present in the mouth that could affect the result. Alcohol is present in some medicines, mouthwashes, and breath freshener sprays, as well as some confectionery and food products. Because alcohol is volatile, it evaporates quickly, and within 20 minutes of consumption, there will be no trace left. This is why we check that the donor has not taken anything by mouth in the 20 minutes prior to the test. We say anything because very hot or very cold drinks could affect the temperature of the mouth and consequently the breath that passes through it, and this arguably could have an effect on the alcohol level obtained. Being rigorous on this 20-minute rule means we can be certain that the results are accurate. However, if people have been drinking recently, they may burp gas from their stomach into their mouth, which will also affect the result. You may not notice this at the time, but it can sometimes account for wide discrepancies between the first and second tests. We also ask that the individual has not smoked in the 10 minutes before providing a breath specimen, as this could damage the fuel cell within the machine that measures the alcohol. The machines all come with excellent handbooks, which we advise you to keep with you. Getting ready. You need to have all your equipment and paperwork ready and laid out in order. You need the calibration record, the alcohol breath test record, and a selection of mouthpieces to give the individual a choice. You need a witness for the calibration check on your evidential machine. We will show you this procedure first. A calibration check is to establish that your machine is reading accurately. Recalibration is when the reading needs to be corrected. With some machines, this must be done by the manufacturer, but with others, you can do this. Where you do this, both the calibration check and recalibration are done using a calibration gas containing a known level of alcohol. The procedures are straightforward. However, the gas in your cylinder is temperature sensitive, so try to keep the cylinder at an even temperature and do not use it straight from the boot of your car in very cold or very hot weather. When not travelling, keep the gas indoors, but away from direct heat. You must make sure that your calibration gas is within its expiry date and record all the data required each time you check it or recalibrate it, even if you are doing this at home for your own training purposes. This provides a record of the machine's reliability. We will use the Lion SD400 as an example for the calibration check and recalibration. The Lion SD400 has the following features: an on-off button, A, buttons B, C, and D, a display panel, rises in single units, status lights, only use when ready, a bleep outlet for audible information, a sampling port, and a printer or dongle socket, mouthpieces, lip to lips, a connector tube, a printer with multiple copy function, calibration gas, and a user manual. Have your witness present and explain that you want them to witness the check to demonstrate that the machine is working properly. Use the calibration record and complete all the information relating to the machine and the calibration gas being used. Have a flat surface to stand and steady the cylinder, as both your hands will be occupied. One holding the SD400, the other pressing the flow button on the cylinder. SD400 calibration check sequence. Switch the instrument on, and before the diagnostic sequence is completed, press and hold down function switch C. When a continuous tone is heard, release C and press and release function switch B. Wait for the ready light. Hold down function switch on top of cylinder for 5 seconds to clear any air that may have collected in the valve. Use the connector tube with a mouthpiece and fit this to the gas cylinder and the SD400. Holding down the function switch on the gas cylinder, let the gas flow through the mouthpiece while you count 7 seconds, saying 1,000, 2,000, 3,000, and so on is a good estimate. As you say 5,000, press function switch C on the alcometer and keep the gas flowing through for the remaining 2 seconds. At 7,000, you can release the buttons on the cylinder and SD400 and disconnect the mouthpiece. Wait for reading. A final reading of plus or minus 5% of the calibration gas value is acceptable. Get your witness to sign the calibration record. If the reading is not acceptable, the machine must be recalibrated. SD400 recalibration sequence. Insert your dongle key. Switch the instrument on, and before the diagnostic sequence is completed, press and hold down function switch C. When a continuous tone is heard, release C and press and release function switch D. The machine will show the value of the gas it is expecting. Adjust this to match the value of the gas you will be using function switches B and D. Press function switch C to confirm the gas value. The reading will flash 5 times. Wait for the ready light. Use the connector tube with a mouthpiece and fit to the cylinder and the SD400. Holding down function switch on gas cylinder, count 7 seconds. On the 5th second, press function switch C on the alcometer while gas flows through for the remaining 2 seconds. Release both switches. The instrument will self-calibrate and switch off. Repeat the calibration check sequence, and if acceptable, get your witness to sign the calibration record. Do not repeat the recalibration process if the calibration check fails again. And do not proceed with the test. Your machine must have a fault, so please contact us. You will be given instructions on what to do about collecting an alternative specimen. If the machine is working properly, you can proceed with the breath test. Collection procedures. The basic rule is to follow the checklist, which is part of the alcohol breath test record. Welcome the donor, present your identification, and ask to see theirs. Explain that you will be using the checklist and that the first question is to establish that they have not taken anything by mouth in the previous 20 minutes and have not smoked in the previous 10 minutes. Explain that you are going to ask them to provide a breath specimen which requires them to blow into the machine, and a result will be available immediately. Confirm that they are happy to proceed with the test. Switch the machine on and wait for the ready light to appear. Invite the donor to select a mouthpiece. Partially unwrap it, leaving the end that the donor will blow through covered. Fix the mouthpiece to the machine. Ask the individual to stand up with their hands by their sides and explain that you will hold the machine. They should not touch it. Explain that they need to take a deep breath and then blow slowly and steadily into the mouthpiece until you tell them to stop. Remove the wrapper from the mouthpiece and, holding the machine at a comfortable height for the donor, not for you, ask them to provide a breath specimen. Encourage them by saying, keep blowing, until you get the indicator from the machine that the specimen has been taken. Dispose of the mouthpiece safely and hygienically, not in an office waste bin. The result will be available almost immediately. The longer it takes, the higher the alcohol level will be. Record the result and obtain signatures on the printouts and paperwork as necessary. If your instructions for the customer indicate that a second breath test is required, then repeat the procedure using a fresh mouthpiece. One copy of the printout should be attached to the alcohol breath test record. Follow instructions for the distribution of the paperwork after the test. The Lion AlcoBlow is a screening machine. The procedures are the same, without the need for a mouthpiece. The appropriate paperwork will have to be completed. Hold the machine in line with the donor's mouth and about 1 inch away, so that they are blowing directly at it. Hold it at a height comfortable for the donor, not for you. Ask them to take a deep breath and blow steadily at the machine until you get the signal to tell them to stop. Any indication of alcohol present in the breath will be shown by coloured lights. If the result indicates the presence of alcohol, this must be confirmed by the use of an evidential machine, following the procedures described above. Donor issues. From time to time, donors will have genuine difficulty providing a specimen. Because the machines detect airflow, they will identify the pattern of someone with poor lung capacity, such as an asthma sufferer, so these are not usually a problem. However, often the circumstances of an alcohol test mean the individual is agitated and hyperventilating to the point where they cannot provide a specimen. They need time to relax and calm down. Some people take time to adjust their blow to suit the machine and may get a couple of abort signals before they succeed in providing a suitable specimen. Another common fault is people taking a deep breath ready to exhale, but doing this when they are already using the mouthpiece. This will also result in an abort message.